They represent all the 7 health science schools on campus in Ann Arbor. And what we're going to do is get them to share, since I thought Dr. DeAngelis made a wonderful approach to the broad concept of how this applies beyond medicine. And we're going to get our colleagues to really start to give the perspective, to broaden this out. And professionalism, as we've all agreed, is an area that touches every profession, every caregiver. So the first question, and this applies to all of the individuals, and I'm going to ask them to kind of go down in order, is how does your school or your profession deal with the professionalism issues raised by Dr. DeAngelis?
One of the cool things at this campus right now is the start of this interprofessional education that we've been working on and putting together this clinical decision-making course where we're bringing together social work and dentistry and pharmacy and medicine and dental, it's 5 I believe, all in the same team. And students learning to be what not only is it like to be a pharmacist, but what is it like being a pharmacist and representing that profession in a team? And there's times when you have to lead that team because it's a drug-related thing. And then there's time for you to be quiet and listen to what the social worker's saying, because what's going on is a social work issue. We need to learn from each other in such a way. And sometimes the professionalism is leading, and sometimes it's being quiet and coming together as a team to come up with the best decision.
And what are the commonalities and what are the differences that you've heard as we've approached this area of professionalism?
I think there's something unique about being at a public university like the University of Michigan, where we actually we have to think about the publicness of being here, the fact that we do have a very direct responsibility to the citizens of the state and what that means for the primacy of the patient. Are we really responding in our educational programs to what our patients really require? Our patients require and desire that we work together in teams in ways that are highly functional, highly effective. And I think the questions we're all asking in our 7 schools are we creating the programs that really support that? So I guess I'd build on the primacy of the patient to say the primacy of society is our ultimate service.
This is an open-ended question, so anybody can offer their perspective on, the values we talk about. How do we actually apply those?
And one of my roles was to lead the state's response in preparedness to Ebola and the challenge of Ebola. That was the very best experience I had in our state in terms of interprofessional response to a health threat. It was led by several graduates of our School of Public Health who work in the Department of Health and Human Services for the state. But one of the key components to it that I saw at the learner level, the trainee level, was here on campus, and it was led at the School of Art and Design, actually. And it was called a charrette around Ebola. And the idea was for design and engineering and, yes, some health profession students to get together and try to design ways to respond to Ebola in West Africa, not here in the U.S., because fortunately, as you know, we've had very few cases here. One of the most remarkable inventions that students came up with over the period of just a few days was a covering that you would put on essentially as a big drape with sleeves that would allow you to hug someone who has Ebola. Okay? That is awesome, because that is about the patient, that is about humanity, that is about principles and practice in action, and that came from students, not from fully trained healthcare professionals who've been out there for their whole careers, but from the ingenuity of our students.
I was going to build on what Bruce had mentioned earlier about this clinical decision-making course. It's really a phenomenal model for a lot of the principles that have been talked about. And so there's a real specific example. I don't know where the poster is, but if you guys have a chance, go and see that poster or talk to the people involved. It really was a remarkable experiment that's going to continue. Basically, the 5 schools set up modules across the 5 different school buildings where the students from the different schools would come together and work on cases that were a little bit more relevant to that school, but then they would rotate like a Ferris wheel, 2 weeks in each of the 5 different schools. They brought 2 faculty to teach at each of the 5 different sites, and one had to be from that school and one had to be not from that school. So it was, to Mary's point, bringing faculty together to actually construct the module and to facilitate the discussions in ways that we never get a chance to do in our standard siloed-based lives. I think it's a great experiment to build on, and if we can create more of those opportunities, I think we're going to start to see the kind of momentum we need to around this movement.
I just want to say what you have here is magical. Don't give it up. And make sure you share this. I love some of these papers that I hear. Make sure you publish them. I sound like an editor now, don't I? But I'm serious, because if you don't publish, you don't share, and other people won't know it.